This is the third in my series of videos on disability and mental health. In the first two videos, I explained that although most of the disability patients I see have been diagnosed with mental illness, and although some of them are clearly mentally ill, I believe the majority are mentally normal people who are struggling under difficult circumstances. And I also discussed what really constitutes mental illness and the general categories of mental illness. In this video, I'm going to describe things you can do on your own to improve your mental health. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done quite a few, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, we tend to think of people as either healthy or sick, and mentally ill or mentally healthy. But I think in both cases, we're dealing with a spectrum from one end to the other. And it's often difficult to decide where we put the separating line between healthy and ill. For example, with physical health, no one would disagree that a patient who's having a heart attack or has acute appendicitis is sick. But what about a person who's very overweight, only eats junk food, never exercises, and smokes a pack a day? Nobody would admit them to the hospital, but I think everybody would agree that they're not as healthy as they could possibly be. Similarly, when we come to mental health, I've described in the past a patient I saw for a disability exam who had schizophrenia, what a layman would call insane, who was hearing voices plotting to kill them and was convinced that people were plotting to kill them. However, that person was able to be clean and groomed, come to the office on time, and answer my questions clearly and understandably. I see many people who aren't diagnosed with psychosis who are incapable of doing all those things. On the other hand, what about a person in their 30s or 40s who lives in their parents' basement, doesn't work, doesn't go to school, and spends all their time daydreaming or watching television? Are they mentally normal or healthy? I think everyone would agree that they're not in perfect mental health and could stand to improve somewhat. And that brings me to my first important point. Regardless if one meets the psychiatric criteria for mental illness, we can all stand to improve our mental health. The next point is that mental health and physical health are often seen as separate, but are really two parts of the same thing. Improving physical health tends to improve mental health, and improving mental health tends to improve physical health. An interesting thing about psychotic patients, people who are insane, is that they live on average a shorter life than people who are not psychotic. But the main reason, or most common reason, is not due to their psychosis. It's due to poor physical health. People who are psychotic tend to smoke more, use more alcohol and drugs, and generally not take care of themselves very well, eating a poor diet, not exercising, not getting regular medical checkups. Likewise, anybody who's been sick or injured knows that you don't feel mentally at your best. So we all can improve our physical health, eat better, take better care of ourselves, exercise more. As I've stated in previous videos, I've worked with amateur and professional fighters, and when you see them, you'd think they're disgustingly healthy, but they're always trying to improve their health by better diet, better exercise, and better training. Likewise, I think that everyone, whether diagnosed as mentally ill or not, can improve their mental health. And there's a lot of things that can be done on your own. The two things that are essential to improve your mental health are, first of all, what therapists call insight. Realizing that you're not as good as you could be and that you could improve. And second is the willingness to do the work. Just like getting physically healthy requires work, getting mentally healthy requires work as well. Which reminds me of the old joke about the psychiatrists. How many psychiatrists does it take to change a light bulb? The answer is one, but the light bulb has to want to change. Psychiatrists know that unless a patient wants to change and is willing to do the hard work, therapy will be useless. And if you're finding this video interesting, you might want to subscribe. I put out a video about every week on disability-related topics. Just like improving physical health doesn't happen overnight or in a week, it takes months or years to get in shape. Improving mental health doesn't happen overnight, in a day or in a week. It's a gradual process. So now I'm going to discuss things that you can do on your own to improve your mental health. And what you want to do is take small incremental steps. Don't try to change everything at once. You're likely to become overwhelmed and give up. And also, don't compare yourself to others. There are always people who are physically healthier than you and mentally healthier than you. And comparing yourself to people who are healthy tends to make people feel bad and inadequate. Compare yourself today to how you were yesterday and a week ago and a month ago and a year ago. And then you will be able to see improvement, and that will be encouraging, and you'll want to improve more. So now I'm going to get into 13 things you can do on your own to improve your mental health. The first is to get up and get out of bed at a regular time, regardless of whether you've had a good night's sleep or not. Set your alarm clock and decide to get up in the morning. Lying in bed awake, fretting over your issues and your lack of sleep will make your mental health worse. The second is to make a schedule. Have a plan for what you want to accomplish in the day. Again, small steps, not overwhelming change. And don't let the schedule become a slave master. Accept the fact that if you don't complete every item on the schedule but have completed some, that's better than having completed none, and count that as a success. The third thing is to practice self-care. By that I mean things like taking care of your teeth, brushing and flossing, staying clean, bathing or showering, making your bed in the morning so you have a made bed to get in at night, putting on clean clothes, taking your medication when you ought to. These types of self-care you will find will improve your overall outlook. None of us feel at our best when we're dirty and unkempt and our living quarters are a mess. The fourth is exposure to sunlight in the morning. Most people know that sunlight provides vitamin D, and low vitamin D levels can be associated with poor mental health. But most people don't know that, first of all, sunlight has an activating effect. It wakes us up and gives us energy if we're exposed to it early in the morning. Second of all, the near infrared rays of the sun, which you cannot see, actually go through the skull and have a beneficial effect on the brain. I'm going to put a link in the description to this video on a very interesting medical lecture on the beneficial aspects of sunlight. You want to expose yourself to sunlight in the morning for about 20 to 30 minutes. The fifth thing is to eat a healthy diet. Eating lousy food doesn't improve your physical health or your mental health. The sixth thing is that many people would benefit from taking a B complex vitamin. The B vitamins are the most important vitamins for brain and nervous system health, and a lot of people with mental illness have low B vitamin levels, and there are many reasons. It can be due to poor diet, it can be due to excessive alcohol use. In fact, serious deficiency of some B vitamins, such as vitamin B12 or pyridoxine, can cause symptoms that are difficult to distinguish from mental illness. The seventh thing is journaling, having a notebook where each day you write down some of your thoughts. You don't have to write a book, just what worked for you or didn't work for you that day. And a good idea is what I call a gratitude journal. Think of 3 things that went well that day and write them down. At the end of the day, when we look back, we tend to think about the things that went wrong, and that can make our mental health worse. Having a gratitude journal forces us to think about the things that went right. The 8th thing is to socialize, have face-to-face interaction with other people. I'm not talking about online socializing either. I think that's a poor substitute for real human contact. The 9th thing is cognitive behavior, which can be somewhat done by oneself. In the description of this video, I'm going to provide a link to a book called Cognitive Behavioral Therapy for Dummies. Cognitive behavioral therapy is a relatively new form of therapy. In the old psychoanalytic form of therapy, the idea was that if you treated a person's emotions, their thoughts would improve. In cognitive behavioral therapy, the idea is that if you improve your thoughts, your emotions will improve. And this is something worth trying. The 10th thing is to consider getting a pet. There is scientific proof that people who have pets have increased mental health compared to people who don't. The 11th thing is to exercise, and a very interesting fact is that exercise has been shown to improve all types of mental illness, including psychosis, where the person is hallucinating or out of touch with reality, and organic brain syndrome, where the person has a physical disease such as Alzheimer's disease that interferes with their mental health. In the old days, before there were very effective psychiatric medications, mental patients used to be taken outdoors every day when possible and have an exercise class. That meant they exercised and were exposed to sunlight. This has been forgotten by modern psychiatric institutions, but I think it's time for it to make a comeback. The 12th thing is to avoid alcohol and drugs. And by drugs, I mean non-prescription drugs such as marijuana and cocaine, and addictive prescription drugs if possible. The issue is alcohol and drugs can be very seductive if one's having mental problems, because they can temporarily blot out or extinguish the distress. The problem is that's temporary, and everything tends to get worse. Physical health, mental health, financial health, relationships, they all tend to get worse with continuous use of alcohol or drugs to treat mental problems. The 13th thing is to meditate, especially if you suffer from anxiety. And there are a lot of phone apps you can find now that will guide you through meditation. Well, that's the end of my list. Next, in the next video, I'm going to talk about things you can do with another person, either a lay person or a therapist, and when it might be appropriate to seek professional help. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.